talking about trying to look younger. We know how we're all trying to do that, right? Women are gearing up to look their best for the holidays. Many are looking for alternatives, though, to plastic surgery or facelifts. Now, when it comes to facial lines and wrinkles, there are countless ads for injectables or so-called fillers. The question is, what exactly are they? So we have Dr. Jeffrey Ptak joining us this morning to talk about some of the procedures, including one called fat grafting. Thanks for being here this morning, Dr. Ptak.
Thanks for having us.
I've heard of fat grafting. It's something, it's not new, but it is gaining more popularity.
Absolutely. Tess, what we've finally, I think, realized is that rejuvenating the face isn't really about higher and tighter. All of our procedures up until about this point have been very two-dimensional, but the face is very three-dimensional. And so what we're trying to do is restore the volume in the face with injectables, both commercial and ultimately using your own fat, because the face actually loses a tremendous amount of volume beginning in your 30s, 40s, and 50s.
Okay, and by the way, we didn't mention this is Kim, who's in her 40-somethings, we'll just say, and you're going to show us one of the more popularity and growing fillers in just a moment. But back to fat grafting, we have some pictures first to show of a before. What did you do with this patient? Tell us about her situation, because she looks like, I mean, she looks like 10 years younger.
Well, actually, this particular photo is with one of the commercial, but an intermediate type of a filler. That's okay.
Okay.
It's called Sculptra. And that's actually what Kim received just a couple of days ago.
Okay.
And Sculptra was first introduced in the U.S. in about 2004. And it's a remarkable filler that can do very large volumes just in the office, and on a cost basis, it's very, very affordable, and you can get very nice shaping with the face with the Sculptra.
What a difference in these pictures. Was this the same used for this lady
Yes.
here in our pictures?
Yes, exactly.
Now, talk about, you know, how many sessions, what type of downtime, if any?
Sculpture is usually done in a series of 2 or maybe 3 sessions,
Okay.
a few weeks apart, and then it can be enhanced, and that's what we're going to do today. Now, this particular photo is fat grafting around the orbit. And
There's
what we
huge difference in the eyes there.
Right, this is not a blepharoplasty. This is just by enhancing the cheeks and lifting the cheeks and actually enhancing the brows so that they stand out a little more, not up.
So where does the fat come from? How do you get it out, and how do you put it in?
And that's the beauty of it. We can actually do this procedure right in the office under a little bit of local, and it doesn't require general anesthesia. We take it from the patient's own body. And it's very reasonable as far as the recovery. The cost on a per cc basis is actually the cheapest filler that you can do.
How long does this last? How often do you have to get it done?
If we do at least 1 full session and 1 touch-up session, you can get a good 10-year result from that.
Wow, 10 years.
We think that at least 50% of the fat that we put in stays permanently with each injection. And so by building that, you're actually restoring the three-dimensional volume in the shape of the face that you had when you were much younger, that begins to go away in your 30s, 40s, and 50s.
Where is fat grafting best used at? You showed the example of the eyes, which was a huge difference by putting into the cheeks, you said, right?
Well, that's somewhat age-dependent, because you begin losing fat around your eyes and around the mouth, but ultimately, most of the facial fat goes away by the time you're in your 60s and 70s. So we're actually grafting the entire face.
The sad part is we think losing fat is a good thing, but it's making us age.
That's right. That's what gravity pulls on, and that's why you sag. And so instead of doing these two-dimensional, sort of higher, tighter, you know, Joan Rivers type of facelifts, you know,
it definitely had a more natural look, I feel.
It has a much more natural shape.
All right, so with Kim, who's here, who's beautiful already, doesn't need any work, but what are you going to be doing with her?
Well, 2 days ago, we just injected a little bit of Sculptra into the cheek areas and under her nasolabial creases, and that's helped to lift them out. And I think we do have
a before picture.
Yeah, a before picture, and you can see
Turn this way for me, Kim. There you go, so we just see it straight.
Yeah, so I think that we've really done a nice job building the deeper tissue, and that's the thing. You really have to know the three-dimensional anatomy of the face so that you can build it with the appropriate filler. So we're just going to add and enhance just a little bit along her nasolabial lines. Okay.
And so this would normally have been done in an office?
That's correct.
When you went for the first time, was there any, what did it feel like? Did you have any bruising or anything like that?
Not at all.
Not at all?
Mm-mm.
Okay.
Just a little under the eyes.
Okay.
But that was about
it. And what is this filler called again, Doc?
This is Juvederm, which is a hyaluronic acid. It's a clear gel. It holds on to water. As long as the product is in the skin, it'll really hold on to water and keep the volume up. It takes about 6 to 9 months for this to begin to degrade, and so it has to be maintained.
So longer than something like Botox,
Oh,
which is
yes.
the more common filler that we're used to hearing
Exactly.
about. Okay,
Okay.
I think he wants me to be quiet. I'll let you do your work there because Kim probably doesn't want him talking while he's doing his work. But if you'd like to learn more about the different fat grafting or different newer injectables right now, we can put it all on our website at azfamily.com. You can contact Dr. Ptak. He's out of Scottsdale, and also his website is there. Oh, she's brave doing this, and I'm glad we're not showing it straight on for the injections.
So we're just injecting into the skin, and we're going to raise that crease just a little bit more.
And the right side was already done?
No.
Partial?
Just her left side is a little bit deeper. We'll do both of
Okay.
her injections, both sides.
Okay.
But this one is a little bit deeper, so we'll get started on this side first.
I don't know if you can talk, Kim. Any pain there? None at all. And you didn't have to give her any kind of local?
No, we didn't. And this does actually come mixed with a local.
Oh,
And
okay.
so as we're injecting, it numbs immediately. So it's
Okay.
a very, very tolerable injection.
Well, we are just about out of time, but again, we're going to put all the information for Dr. Ptak, and if you'd like to learn more about the fat grafting as well as the different injectables, the newer ones that are available that'll last longer and have a more natural effect. Thank you so much for joining us this morning. We sure appreciate it.
You're very welcome.
Thank you, Kim, for being brave and doing that on camera.